So, my dear students, I have taken up a challenging topic, a rather complex and abstract one, to which we will have to infuse a pathological sense. Thanks to this wonderful thematic picture from Newsweek scientists, a lot can be learned from the picture. Credit goes to them. The Alzheimer's disease. In order not to forget, always there should be a list of headings. Think of the subheadings. The subheadings will take you to the answer. We shall try to unravel what they mean. In the meantime, I am seeing a picture of a lady who is somewhat lost, thinking a lot, but not able to recollect what is needed. And perhaps within her is a kind of a confusion that cannot be satisfied or solved that easily. This is the most common cause of dementia in adults. It increases with age. Look at this one, 3% between 65 to 74, 19% 75 to 84, 47% more than 84 years of age. And most cases are sporadic. Sometimes it can be heritable also. They say that by 2025, more than 7 million people in the world will be affected. And it will be increasing to 131 million by 2050. And you find that there is a dementia summit which had identified it. From then on, there has been a study of this Alzheimer's disease. And this is Aloy Alzheimer. He is a neurosurgeon and he happened to identify it in a patient called as August Ditter, 51-year-old female. The picture of whom you had seen in the first slide. She was hospitalized in 1901 and there was a complaint of dementia including memory loss, dysphasia, aphasia and loss of orientation, hallucinations and delusion. She was treated by Alzheimer and the entire thing is confined to one line, I have lost myself. In fact, when he left the hospital also, the brain records were sent him and ultimately after a study with his colleagues, he identified the amyloid plaques and the cerebral atrophy. So this is an article that has been written by Alzheimer himself. And also a sketch of the neurofibrillary tangles drawn by. So this is the death and legacy of the patient. In 1902, the doctor Alzheimer, he left Frankfurt, the castle of the insane, as it was called, Ehrenschloss. Frequently inquired about the patient. And in 1906, she died, after which the brain records were obtained, medical records were obtained and it was studied. And the death was due to sepsis and probably it was a pneumonia developing from a blood sore. It was aided by these people and ultimately senile plaques and neurofibrillary tangles were identified to give a diagnosis of Alzheimer's disease. Probably in today's world, the disease would have been identified much earlier. The normal human brain weighs about 1200 to 1400 grams. The decrease starts after 45 to 50 years, lowest after 86 years. And after 100 years, not much. You still have some brains of 1097 grams. And after that, beyond that, maybe if you want a longer life, you will have a lesser brain. The dura mater is thickened. The arachnoid matter is also thickened at the convexity. And there is a decrease in the brain weight, atrophy of the gyri, widening of the sulci. And there is a decrease in the neurons and the volume of the white matter. This is a general finding that you people can very well write in your exams. There are some major neurodegenerative disorders. So you will have to mention them as a differential also. One is Alzheimer's, frontal lobe degeneration, Parkinson's, Huntington's disease, spinocerebellar ataxia, and amyotrophic lateral sclerosis. So in all these, there will be some kind of dementia or a behavioral change, language disturbance, kinetic movement disorders, cerebellar ataxia, etc. You can apply it to the particular disorder. Also, you find that in Alzheimer's, there is the amyloid plaques as well as the tau tangles. This tau can be found in some other conditions also, such as Parkinson's or the frontal lobe degeneration. So the other things you people can go through, it's a very good table that has been provided by Robin Simpson. The common clinical features of the Alzheimer's by stage. There is an early stage, intermediate stage, and a late stage. In the early stage, you find memory, there is a poor recall of latest information. Old memories, of course, remain. There can be dysnomia, or there can be a lack of fluency, misplacing the objects, difficulty in driving. Intermediate, you find that the remote memories are being affected. Earlier, it was not so. Non-fluent paraphasias and poor comprehension or understanding. Getting lost. This is extremely important. I do not know where I am. Difficulty in copying figures. In the later stages, untestable and the language is near mutism. They do not utter a word and untestable. Behavioral, you find that there can be delusions, depression, etc. Later on, there can be agitation and want. So this goes on. And neurologically, you find that the face, hand test, and agoraphobia. And also you find the frontal release signs, etc. These are something like neurological. There can be a myoclonus. So you people can try to decipher in your own way. Only thing I will be able to understand is there is an early, intermediate, and a late stage, and there is a progressive deterioration of the neurological condition. So this again is put in the form of a graph thanks to this particular reference. So all of the things have been mentioned again. Elaborating thoughts, change in behavior, loss of memory, abstract thinking, speaking, disorientation, lack of judgment, etc. Simple tasks also cannot be performed. This is the August Ditter's brain. So this is the brain over here, and in which two things have been identified. There is an amyloid plaque over here, and there is a neurofibrillary tangle. These are the things. So this is the amyloid plaque A and B that is there, and they can be demonstrated by means of this Belshevsky-Silver stain. The drawings have been depicted by Alzheimer's own work. This person pertinently I did because Belshevsky has done a lot in contributing to the neuroscience and to the stains. Look at this one. There are the separated neuroglial cells, and then you find that this is probably a cerebellum, the Purkinje fibers, etc. There is some kind of a disorientation, but very well brought out by means of a silver stain. That is the purpose of it. Belshevsky silver stain, you people can mention. Thanks to Wikipedia neuroscience courses. And later on, this will be the neurofibrillary tangles and the amyloid plaques that can be found at the brain. Look at this. Again, there can be a circumferential deposit also, or it can be in the form of plaque-like things that can be seen. There have been certain unique personalities who have been suffering from this Alzheimer's. Starting from Princess Diana, whomsoever you can mention, there is the entire list you people can try to trace. And this, of course, is the former President of the United States, Sir Ronald Reagan. Bright Focus Foundation has given me the list. And this is what is happening. Sometimes you find that these are all the amyloid plaques that are getting formed in between the neurofibrillary fibers. The manifestations, you find that the higher function is being affected in the final stages. mute, disabled, immobile, and finally the death is there. And they say in order to avoid such things, there can be a game such as chess to be played so that it makes you think and then to comprehend, to recollect, etc. The major diagnostic criteria will be these things: loss of memory, aphasia, apraxia, agnosia, etc. And significant impairment in social and occupational function, etc. Cognitive decline. Cognitive means understanding. And the symptoms are not due to neurological, but due to abuse of certain other things, then it is called as dementia. This is a sequence of events, thanks to Wikipedia, that we will have to understand. So you find that there is a, of course, there is a fibril over here, and then there is a bundle of this microtubules within it, and this is the cell. What happens is there will be a degeneration of these microtubules. And within the neuron, I'm able to find this microtubules. So there is a degeneration that is happening over here. This is what I'm finding. So please do remember degeneration of the microtubules in the brain cells. So neuron over here, then the microtubules, they are undergoing a degeneration. And finally, there can be a tangled mass that can be formed out of it. So there are basically accumulation of two proteins. One is called the amyloid beta and then the tau protein. There can be plaques or tangles. Plaques means it is just an elevated or a depressed lesion. And tangles means it is a kind of intervening of the fibers. The actin and myosin filaments, etc., they can together form this. Secondary effects can be neuronal dysfunction, neuronal death. The nerve fibers themselves can undergo a death. There can be an inflammatory reaction secondary to. And for this, it is said that the gene coding for this precursor proteins undergo mutation, as a result of which this is formed. Let us see how it happens. The mutation in the gene for tau occurs in the frontotemporal lobar degeneration. So, pathogenesis, I would like you people to kindly refer Robbins also. You find that it involves the amyloid beta and the tau protein. Amyloid precursor protein, it leads to the amyloid beta, and there is a sequential cleavage by means of BAS, beta amyloid converting enzyme, and alpha and gamma secretase. These are important words that we should remember. Now, when there is going to be a mutation in the precursor protein or in this kind of secretase, then there can be a defect. Also, you find that they are all located in chromosome 21. And another disease that we know about chromosome 21 is our famous Down syndrome. That is why the patients with the Down syndrome can develop an Alzheimer at an earlier age. So this is a normal sequence that you people are seeing. At here, Alzheimer's disease, education, and referral center. Beautiful. So the cell membrane, this is amyloid precursor protein, and there is a tangled fiber that I'm seeing. What happens is the enzymes can be acting on this amyloid precursor protein, and then there can be a cutting or a cleavage of it. See what is happening. So the beta amyloid is being cut by means of the enzymes. Now, when it is done in a proper way, fine. But otherwise, there can be a mispresentation. As a result of which, you will be finding the senile amyloid plaque or the beta amyloid plaque. National Institute of Aging for this. So that is what is happening. This will again be seen. So the microtubules, they will be disintegrating. They can be causing the death of the cell or the defect in the cytoskeleton. So one, there can be a degeneration of the neuron itself, or two, after that you find that these can be precipitated outside. Therefore, extracellularly, you can get the amyloid plaque. The brain and the Alzheimer's disease. As I told you, varying degrees of atrophy, widening of the cell size, and ventricular enlargement, hydrocephalus ex vacuo, neuritic plaques, extracellular, and neurofibrillary tangles, intracellular. This particular table or lines, I think you people can memorize very easily. And The neurofibrillary tangle, it contains a tau protein and it is a microtubule associated protein. The tangles of this Alzheimer's disease shift the tau. There is a loss of the microtubules. There are two pathways. One, there is an aggregate of the tau protein as a result of stress response, or there can be a neurotoxicity, finally death of the neuronal fibers. Genetic locus is one. So this is the brain that you people are seeing. Look at the atrophy of it, widening of the ventricles and the widening of the sulci as well. 3 epsilon, this also I have been mentioned. These are all certain additional points that you'll have to mention. Basically, it will be the tau protein and the amyloid. The other things can be the apolipoprotein E encoded in chromosome 19 or 3 epsilons, 2, 3, and 4. And what is the role of inflammation? Ultimately, all of them can lead to a production of a large quantity of this plaques and tangles leading to Alzheimer's disease. So this is the chest that I have mentioned, and this is the picture of the patient. First was the first to describe the case because it became known as Alzheimer's disease. The microscopic changes are amyloid bodies, granulovacuolar degeneration, keranobodies in the hippocampus, amyloid plaques, and neurofibrillary tangles. So neuritic plaques in this one. So look at this one. In this one, I'm finding the neuronal fibers and the plaques are getting formed. They can occur in senile changes or in the dendrite as well as in amyloidosis. They are all spherical structures or dilated and tortuous. This is the diameter and the dimensions of them. There can be a microglial reaction in the surrounding astrocytes. The common region will be hippocampus and the amygdala. Look at this one. There is an amyloid plaque that is being formed. A normal region. CA3 is one region that has been mentioned in which there can be a diffuse plaque that is getting formed in this one. Or it can happen to be a tangle within it. Sometimes what will happen is I'm getting a vacuolar degeneration. Look at the numerous vacuoles that can be seen in neural tissue. There can be a granulovacuolar degeneration that is there. Granulovacuolar degeneration, you find that the granules contain vacuoles, the cytoplasm of the neurons. Even in normal aging, they can be seen. And these are some people who have contributed to it. Belchowski, Silverstein, I had shown you earlier. The vacuoles will be about 3.5 microns in diameter with a central granular core. So, this is the thing, granulovacuolar degeneration that is happening. This is a normal cerebellum. You find the density of the fibers. Here they are getting separated. That can be appreciated thanks to this person who has drawn a sketch of the entire region, CA1 region, most affected. And this is the prosubiculum. That is the density of the neurons is lost. The mechanism of it is unknown. The neurofibrillary tangles. You find that normally they are bundled and paired, basophilic fibrillary structures within the neurons or the cytoplasm. They displace the entire nucleus and they can persist even after death. The common sites where you can see them will be the cortex, hippocampus, and the amygdala. This diagram, I think, summarizes it a little bit. You find that the aged glia become somewhat senescent and they can lead to the formation of the amyloid aggregation, and this is the vascular pathology. There can be the tau pathology as well. You find that the fibrils, they all become abnormal. There is a glial reactivity in the surrounding tissue. Also, there is a loss of the synaptic tissue and there is a cognitive decline. There can be oxidative stress and the other inflammatory cytokines which can also contribute. This is the central Alzheimer's pathologies. Kindly go through it. Or if that is difficult, this is somewhat easy. So the normal human brain, you find that there will be some kind of an amyloid plaque in the microglia, and the normal amyloid beta protein will be somewhat cleared. So it does not persist. And this will be the synaptic junction between the neurons. This is healthy. There is no accumulation and no neuronal damage. But here what happens is, in a case of Alzheimer's, you find that the same amyloid plaque is there. It is not removed, as a result of which there is no clearance of the amyloid beta, and therefore there is a synaptic junction through which the connectivity and the impulse is not transmitted. A microglia, there will be the accumulation of this amyloid beta protein which can be there. So this is a beautiful diagram which again condenses all the findings. So amyloid lipo, amyloid if you do not understand that, then this is a beautiful picture. This is a healthy neuron, a healthy brain. You find that there are the adjacent neurons through which the connection is being maintained. The amyloid plaque can be there, but then it is normal, it does not get accumulated. But in a case of Alzheimer's disease, you find that there is aging, you can understand the atrophy of the brain, there is amyloidosis, the tau protein, there can be the neuroinflammation, mitochondrial dysfunction, etc., calcium deregulation, and neurovascular degeneration. The amyloid gets accumulated, as a result of which it is not clear, there is no synaptic connection between them. And this can lead to microglial reaction, synaptic loss, etc. Again, the same thing, if it is not very difficult for you, kindly see. There is a kind of a reaction with the various substances that are being produced. This is not very difficult for us. So there is a capillary from which you are getting all these mediators. And these are the neurons which are undergoing degenerative changes. Or from the mitochondria, you know that there can be a defective calcium homeostasis. And all of this can lead to Alzheimer's disease pathology. There can be the pathology in the amyloid precursor protein, or there can be amyloid plaques which can be formed, leading to a neuronal loss, also the tau aggregates. So this particular one, any of this, thanks to research, you people will be able to recollect. So the pathogenesis, again, it is not there. So you find that there is a decline in the acetylcholine neurotransmitter, and it leads to impairment in the impulse transmission. The brain, the normal brain, and then a brain in a case of Alzheimer's, again the cut surface, a slice of it showing the ventricular dilatation and the cerebral artery, which is being reflected by means of the PET scan. Sometimes they say that such plaques can be shrunken by means of treatment, but that is controversial. So again, a summary of the same thing. I would like you people to kindly go through the entire thing. What you people are seeing, the picture is from ResearchGate. A is showing the plaques over here, and then the neuritic plaques are seen in B over here. Amyloid beta protein is seen. So there is a central core around which it is getting deposited, and finally you find that the tau proteins are being there within the neurofibers. So that comes to a state of confusion, and tell me and I forget, teach me and I remember, involve me and I learn. I would like you people to kindly go through this disease repeatedly. Listen to my class and then go back to your habits so that you are able. Thank you.